So, over the years, a lot of patients have come in with low back, sciatic type back pain. And most of them have told me that they do a core routine or core exercises. And what I've realized over the years is that they're mostly doing advanced, super high intensity core exercises like sit-ups, planks, leg lifts, stuff like that. And what I realize is they're getting pain, muscle spasms, pain here, going down their leg, or just pain bilaterally across the belt line. They're getting that pain because they're missing the foundational beginner type core exercises, because these are so small and detailed, these exercises, that a lot of people don't do them. Trainers don't teach them. They just don't get done. So I teach patients how to do this stuff, and we solve the foundational core weakness, dysfunction type issue, and they get on the road to recovery. So I want to just show these basic ones right here. Very first one is called the pelvic tilt, and this is step one in a long line of progressive steps on how to make your deepest spinal stabilizing muscles strong and stable. So basically, step one, you're lying on your back. Now, naturally, you have a space under your low back here, so all you're going to do, you're going to pull it in tight, 5-second hold, and then release, and then again, you'll get up to about 20 reps. And you can see my pelvis tilt, hence the name pelvic tilt. So that's a 5-second hold. Now this is pretty easy. I'll get my hand under there to make sure people are doing it right. I'll get some patients though that are very deconditioned and never really did this, and they just can't get it. It actually takes a couple visits just for the brain to connect with those muscles in there. So that's step one, which is easy. So now we go to step two. And you always start with step one, that's the most important core exercise I'm going to teach anyone. So you do your step one, your pelvic tilt. You hold that, you raise your leg up, and you hold that for 20 seconds. So it's getting harder because my thigh is up in the air. And after 20 seconds, drop it down, reset here, pelvic tilt, step one, raise the other thigh up, that's step two, do another 20-second hold, drop it down. So that's step two. Now, as long as they can do that and there's no pain, we move on to step three. So again, you're always starting with step one, pelvic tilt, hold that there. Now you're going to raise both thighs up. That's step three. Now, the whole time, I'll have my hand here, or at least make sure that they don't lose that contraction. If the low back comes off the mat, that means that you're not strong enough to get up to that step, because it's progressive steps. So this is step three. Step four, we'll raise the arms. And again, you can't lose that contraction. It has to stay into the table, because that's stabilizing your spine. It's protecting your spine. If this comes off the table, you're no longer protecting your spine, and you're setting yourself up for injury. So now this is, I think we're up to about step four, step five, alternate each arm back. And right about there, I have to recruit more of the muscle fibers in my deep core in order to hold that contraction. So now I'm alternating up to 20. If you're good with that, then you can get to the next step. Bring a leg out. This is when it starts to get very advanced and hard. You're not going to be doing these right off the bat, especially if you're dealing with moderate to severe low back pain. And now, the hardest, it's called the dead bug. You're going to go opposite arm and leg, just like that. And again, the key is, as you're doing this, the key is that you never let go of this contraction. All right, so that's basically how you progress through a good core workout. Thanks for listening.